For every hour a primary care physician spends actually seeing a patient today, they spend 2 hours filling out paperwork. This chart tracks the market share of independent medical practices over a decade. In 2012, 60% of doctors worked in these small, relationship-based clinics. By 2022, that number dropped to 46.7%. If we look at stagnant revenue compared to overhead, the cause of that collapse becomes obvious. Today, a practice spends $40,000 to $60,000 per year on administrative overhead for every single full-time employee on the payroll. Small clinics are disappearing because they can no longer afford the human labor required to feed the administrative machine. The typical adult navigates 5 to 7 entirely disconnected health systems every year. You have a primary care doctor, a couple of specialists, a pharmacy, a lab, and an insurance company. Because none of those systems were built to talk to each other, the patient becomes the integration layer. We call this the human API. Every time you recite your medication list from memory, or a doctor faxes a medical record across town, humans are doing the manual labor of routing data packets between disconnected software. Digital records were supposed to fix this, but a system of record only stores data. It still leaves the actual work of coordinating care entirely to humans. If a practice is going to remain independent, it needs technology that does more than just store files. It needs a system that can actually absorb the administrative labor that is currently killing the business. Proscription Health operates as a digital workforce. Instead of just hosting data, the platform executes clinical and administrative tasks that usually fall to human staff. Every practice runs a cow-work agentic system, a coordinated team of specialized AI agents. When an appointment is booked, the scheduling agent secures the time, the billing agent verifies insurance, and the credentialing agent monitors licenses, all handing off tasks in a silent choreography. Instead of arriving to hours of triage, a doctor starts their day by reviewing a single executive briefing of the work these agents completed overnight. This diagram shows the personal AI health companion at work. If a doctor prescribes a new medication, the companion instantly cross-checks it against the patient's entire history, including drugs prescribed by outside specialists, and flags any dangerous interactions before the order even reaches the pharmacy. By absorbing the administrative load on both sides of the exam room, these AI coworkers buy back the time required for a doctor and a patient to focus on each other. But healthcare is heavily regulated and high stakes. A general-purpose chatbot cannot safely manage a medical record or a billing cycle. Proscription Health's agents are built with deep domain expertise. They are encoded with the specific logic of independent practice, from payer-specific coding rules to the nuances of state-by-state credentialing. This secure trust layer actively filters and blocks unauthorized actions between the data monies and the execution layer. It is the only way to authorize an autonomous agent to touch a patient record without a human intermediary. This system operates on the principle of user sovereignty. Every action taken by an agent is strictly audited, and the human always retains the power to pause, revoke, or override the software's decisions. In the healthcare sector, this level of regulatory compliance is a foundational moat. It creates the trust required for autonomous action to actually happen in a clinical setting. Once these agents are reliably running the internal operations of a clinic, they can begin to communicate with other organizations across the entire healthcare ecosystem. In this horizon-free future, a patient's agent will negotiate directly with a pharmacy's agent or an insurance company's agent using secure, universal protocols. Instead of a patient repeating their history at every new office or a doctor chasing down a prior authorization by fax, the agents securely broker the context and complete the transaction in seconds. These agents become the coordination layer for the entire market. They scale the operational reach of a small practice without ever adding a single person to the payroll. Armed with this AI workforce, a 2-physician clinic can economically compete with a massive hospital system, staying independent while offloading the work that leads to burnout. This evolution connects directly to Proscription Health's core brand symbol, the Sankofa bird. The Sankofa bird represents looking backward while moving forward. It is a metaphor for using the most advanced autonomous technology available to rescue the relationship-based medical practice of the past. The ultimate irony of AI and healthcare is that offloading the paperwork to machines is the only way left to make medicine human again.